Okay, we're live streaming now. Okay, a few of them has joined. Yeah, we can start now. Hello, everyone. Welcome back to our weekly chai chat. After a brief break, we are excited to be back. And I hope everyone has their chai ready to enjoy today's chai chat. And Mr. Vas will be joining us shortly. He is running just a few minutes behind, but he will be with us soon. Has their chai ready to enjoy today's chai chat. Mr. Vas will be joining us shortly. He is running just a few minutes behind, but he will be. Sorry, I had so many echoes from the YouTube live stream. So our special guest for today is Miss Derry Hussain, and we're thrilled to have her here. She is a registered dietitian with a specialized expertise in weight management, diabetes, oncology, and health promotions. With a master's in nutrition and diabetics from Roberts Gordon University, she has experience in both acute and community care, including clinical internship at hospitals in Glasgow and Queen Elizabeth University Hospital. Derry has provides personalized dietary guidance for conditions such as obesity, diabetes, IBS, liver disease, and celiac disease, and has consulted on complex cases requiring parental and enteral nutrition. She is an active member of British Dietetic Association and Parental Nutrition Association. So let's welcome Ms. Derry Hussain for today. And Ms. Hussain, the floor is yours. You can start with your presentation.
Thank you so much. Thank you for the lovely introduction, and thank you everyone for joining. I hope what we will be discussing today will be of benefit for yourselves. And I believe by the end of this 15-minute session that we will hold, we'll also have, you can correct me if I'm wrong, we will also have a Q&A session where you can also be able to ask me further questions if there appear some. But yeah, I'm just going to try to share my screen now. Hopefully I'll be able to do that. I'm not a really good tech person, but let's see if it's going to work. Right. Can you see my screen now?
Yes, we can.
Perfect. I'm just going to try to now put it on a
Full screen.
slideshow.
Okay.
Yeah. Right. Got it. Can you still see my screen on a full screen though?
Yes, yeah, we can see it full screen.
Amazing. Okay, let me just figure out the Zoom tabs here so they're not in front of me. The thing I hate about virtual trainings is all the tech. Sometimes it can go so wrong.
Yeah.
Right.
This happened in our previous chai chats. It's all right.
Yes, it's the usual, honestly. We get used to it, but sometimes tech just surprises us, I guess. So today's talk will be about dietary interventions for inducing remission in type 2 diabetes. And I would like to start with the fact that type 2 diabetes is actually getting more and more common in like individuals around the world. And previously, back in the history, we thought that it is something that comes with increased weight. And we do know that obesity, of course, is increasing the risk of type 2 diabetes. But nowadays, more and more, we can see that, in fact, a lot of children, a lot of pediatric patients also get type 2 diabetes. A lot of young people get type 2 diabetes, which back in the history, we would not associate individuals in such young age to be affected from type 2 diabetes. I'm going to try to change my slide now. So a little bit more about myself, although I received a brilliant introduction. So my name is Derya Hussain. My background, I'm coming from a Turkish family, actually. So half of my family is in Turkey and half of my family is in Bulgaria. I've become a registered dietitian in Scotland. So I love saying that I'm a dietitian made in Scotland. I've managed to work in different hospitals around Scotland, and also I've managed to found something called Dietitian Med, where I am basically providing my expertise to different individuals, industries, patients, etc. my special interests, as already announced, are weight management, diabetes, oncology, and health promotion. And I recently also specialize in nutrigenetics and nutrigenomics. So it's a topic that I really enjoy exploring more and more. I'm not going to talk about more about myself. I'm not that interesting of a person. But moving forward to our slide 3 here. Studies such as the DIRECT trial from 2018 suggest that dietary changes can lead to remission in up to 46% of people with type 2 diabetes, especially in early stages. So diet is absolutely crucial. And throughout this presentation, we will be able to see why and how diet is crucial. But even from my own expertise, I can tell that through diet, patients can reach remission really fast in their lifetime. So it is something that should not be overlooked for sure. So as a definition, probably all of you guys here know that type 2 diabetes is a metabolic disorder characterized by insulin resistance and elevated blood glucose levels. And it is often associated with obesity, diet, and lifestyle. But as I said in the beginning, we now see more and more that it's not only associated with the things I just mentioned, but it can be associated with a lot of other metabolic disorders. It can be associated with increased stress. You personally might know people in your life, or you might be yourself one of those people who experienced a tremendous amount of stress at some point of their lives and then just being diagnosed with type 2 diabetes, which is really commonly seen these days and nowadays. So the remission goal. Remission is achieved when blood glucose levels return to non-diabetic ranges without medication for at least 6 months. And I do appreciate probably around the globe that those guidelines might be various and different. So bear that in mind, and evidence shows that diet can play a significant role in reaching and maintaining remission. Not only reaching, but also maintaining remission, because it can bounce back even if remission is achieved, if people do not continuously take care of their diet and lifestyle modifications, they can bounce back and turn back to what it's been there. Moving forward to our next slide, where we're going to be talking about key dietary strategies for remission. So some of the things that we're going to be looking at will be caloric restriction. As I said, the DIRECT study found that low-calorie diet, which was approximately 800 calories per day over 3 to 5 months, helped patients lose significant weight. But there is a huge highlight here. 800 calories is nothing that can be sustainable in time. And also 800 calories can also be, if not monitored from a specialist, and if this individual is following a diet with 800 calories, it can also lead to negative effect on the body and on the organism of people. So this is just a trial. This is not a recommendation. Significant calorie reduction lowers liver and pancreatic fat, restoring insulin sensitivity and reducing insulin resistance. My personal opinion, and other studies support that opinion, I would say would be that 800 calories is too low, and I would not recommend that if not monitored throughoutly. So weight loss focus is another part of the remission. Studies show that achieving approximately between 10 to 15% weight loss increases remission rates, as body fat, especially around the abdomen, is linked with insulin resistance, or reducing this fat specifically in this area. So maybe when you're working with patients or individuals, or maybe when you're tracking your own progress, if you do have type 2 diabetes, it is really, really crucial that you take weight and also waist circumference measurements, because this is the sign that probably you will be your remission is declining or progressing. So it's a good anthropometric measurement to track over time. And for weight loss focused dietary tools, again, can be low calorie diets, meal replacement, or structured weight loss programs, and they're considered as effective looking at the research in this area. We're going to be talking a bit more about them in the next slides as well. Moving forward, we're going to be starting with the low carbohydrate diets. So benefits of such diets, according to research again, is that those diets usually contain approximately and less than 130 grams of calories per day, which is, believe me, really low. And again, I would not suggest that to be done with no expertise alongside. But what studies show is that they can improve blood glucose levels and blood glucose control, leading to reduced HbA1c levels and weight loss in long term. However, I love saying that just our brain purely per day, it needs approximately around 120 grams of carbs per day. So 130 grams is absolutely nothing. And I do believe there are better ways than using purely energy restriction and carb restriction, because as I said, in long term, it can have its negative effects as well. But evidence shows that systematic reviews especially indicate that low carb diets can reduce HbA1c, as I said, by up to 1.1% in people with type 2 diabetes. And the mechanism behind all this is that reducing carbs minimize postprandial glucose spikes and lower the insulin demands. Again, I'm going to open a bracket here. There are other ways to control those blood glucose spikes through diet with no essentially moving that far with the restriction in terms of carbs. We're going to be talking about all this. So very low carbohydrate diets. Again, there is some research there supporting their benefits. I wouldn't suggest going with the very low carbohydrate diets as well, because as hyperglycemia is not beneficial for type 2 diabetes people's bodies, hyper and hypoglycemia are equally not beneficial. So because I've been having individuals with whom I worked, they would come to me and say, probably you had those people as well, they would come to you and say, well, I've been diagnosed with type 2 diabetes, and my doctor just told me to stop eating carbohydrates, stop eating bread, pasta, and rice. And now I stopped it, but I feel so bad. I feel dizzy all the time. My hands are shaking. So in this case, we're actually having the opposite of hyperglycemia. We're having hypoglycemia, which is not really beneficial for the individual as well. And this is what low carbohydrate diets can do sometimes. So it's a really tricky advice to give. And if you hear your patient or if you hear anyone with type 2 diabetes saying, oh, I've been advised to stop carbohydrates, please stop them from doing this, because this is not what they should do. We need carbohydrates. They are our own and main source of energy, and we cannot proceed without them. Yes, you might get into the stage of ketosis, but how long you'll stay there? And there are, again, other implications with that. Intermittent fasting. For those who don't know what intermittent fasting is, this is when you stop eating for a certain period of time and you only have a gap of hours where you have some dietary intake. So studies again show some positives and some negatives from the intermittent fasting. Mostly the positives of the intermittent fasting is not related on how exactly the blood glucose levels change with the intermittent fasting, but they're more linked to the calorie restriction again. Because you can imagine that if you only have 4 hours or 6 hours gap to eat during the day, you might not be able to eat the amount of food that you would usually be able to eat if you have the whole day to eat. So again, it is linked to reduced calorie intake, and the benefits of it probably and more likely are associated with the reduced calorie intake instead of just purely affecting blood glucose levels on the fasting period. Moving forward with the slide. So this is one of my favorite slides here, and it is about why increasing muscle mass is actually important in type 2 diabetes. And I will just start with some of the bits here. So first of them is improved insulin sensitivity. As some of you might know, muscle is a primary site for glucose uptake. So skeletal muscle is responsible for about 80% of glucose uptake after meals. And increased muscle mass improves the body's capacity to absorb and utilize that glucose effectively after meals and throughout the day as well. Also, there are like tons of research highlighting the benefits of it, and studies showed that increased muscle mass enhances insulin sensitivity in the body, thereby reducing insulin resistance, which is a key factor in type 2 diabetes. Another point is enhanced blood glucose regulation. So when we are increasing our muscle mass, we are also enhancing the blood glucose regulation. So what happens exactly? It's all about the glucose storage. We know that muscle tissue stores glucose as glycogen in the muscle tissue. With more muscle mass, the body has an increased capacity to store that glucose in form of glycogen, reducing the circulating blood glucose levels and likelihood of spikes. And third part would be, again, increased resting metabolic rate, which is basically how much energy we can use when we are doing nothing, just existing, just breathing. We're not doing any activity. And this RMR, basically resting metabolic rate, is meaning exactly this, how much energy we use by just existing. So by increasing our muscle mass, we are actually increasing resting metabolic rate, which means that muscle is metabolically active tissue. We know that, meaning it burns more calories when we're just purely resting and existing. And higher muscle mass increases RMR, which can aid in weight management for long term and prevent excess weight gain and contribute to insulin resistance remission. Another bit is the reduced risk of comorbidities. Muscle mass is basically protective against cardiovascular diseases, and it is proven with tons of research. Again, increased muscle mass is linked to lower body fat percentage, which can reduce cardiovascular risk factors. And we know that type 2 diabetes individuals, they do have an increased risk of getting cardiovascular diseases. And last but not least, improved function, mobility, and quality of life, which I believe is one of the most important as well. Maintaining muscle mass supports physical function, mobility, independence, particularly in older adults with type 2 diabetes, as they tend to lose almost like their independence, and they tend to need more and more support alongside going through that journey. And as you can see, I here made a note on the slide saying that studies show that increased muscle mass enhances insulin sensitivity, thereby reducing insulin resistance is a key factor in type 2 diabetes. Apologies for that dot here. It's not really visible. I guess when I was saving the slides, probably it turned to move my font size. So moving to another slide, I'm gonna highlight the importance of muscle mass in everyone's lives, actually, not only with people with type 2 diabetes, but everyone who is existing and breathing. It is important for you. Why? Because there is something called anabolic resistance. This is all about the fact that when we are aging, and we age with every day, it's inevitable process since day one, since we've start breathing, since we've born, we start aging. That's the natural process. And with the process, now we know, thanks to all the research and scientists in this area, we actually know that after the age of 25, 35, depending on the population and group that we are looking at, the rate in which we are losing muscle mass starts increasing more and more, more and more. So we rapidly start losing our muscle mass. And by losing that muscle mass, we link this situation to something called sarcopenia, which is again something which again means muscle mass loss, but associated with aging process specifically. And it's linked with low muscle mass, poor muscle strength, affecting mobility. And we already talked about how it is linking to type 2 diabetes as well. So again, it is crucial to engage in physical activity, and it is crucial to focus on our dietary intake to maintain a good muscle mass and avoid instances of sarcopenia, because it has a crucial effect on everyone's health, not only type 2 diabetes people. Trying to move my slide, I'm a bit slow. So again, I know that I'm talking a bit too much about muscle mass, but believe me, it's not enough. Like, no one is talking enough about it. So the shared burden of low muscle mass. usually when I see, I'm gonna allow myself to share a personal experience here. Usually when I see patients or individuals or clients in my practice, which are above the age of 55, 60, it is really hard to convince those people. Maybe it's a generational thing. It is really hard to convince these people that they have to take care of themselves. Honestly, it's absolutely hard. And I'm like, absolutely sure, even with my parents, I'm absolutely sure that if I go to my parents and say, hey, mom, hey, dad, would you do this for me? Like, if you know that I'm going to be healthier eating, let's say, 60 grams of protein per day, would you push me to eat more protein? And they will be like, yeah, sure, we'll do that. My mom probably will cook me and give me this food because she would love me to be healthy, right? So I realized over time that people, especially parents, and if there are parents here, and I'm sure there are parents here, myself, I'm not still a parent, I'm still a child of a parent, but I'm pretty sure that, and I've seen this, parents can do anything for their children, right? I'm probably right here. But when it comes to them, they don't really do that. And I almost like obtained that thing in my practice saying, if you want to be longer with these children, if you want to be able to pick up your grandchildren, to run with them, to go to activities with them and not purely wait for them at home because probably you feel tired, maybe you get out of breath going outside with them. I mean, just put your priorities. If you want to spend quality time with your kids, you have to take care of yourself. So we want you to be healthy. So we want you to take care of yourself first so you can be with us for longer. And I think this is what made a difference in my practice. This is what changed their perspective of taking care of themselves. And here on the slide, you'll be able to see why muscle mass is important. I'm not going to go through all of them because probably you had a chance to read some of them when I was talking. So I'm going to just move to the other slide. And it is how much protein is enough protein and how much we should take. So the guidelines that we do have, they are approximately 1.8 grams per kilogram. So how you can use these guidelines is basically multiply 1.75 for easier use 1.8 by your weight, and you will be able to see how much protein approximately you will need per day. Anything below that number means that you're not taking enough protein. Apologies. I think I'm getting out of time and I have a few more slides, but this is the easiest way to do that. Moving over the slides. So again, where does physical activity stands? I'm not going to talk a lot about this one here as I'm mindful of the time, but the recommendations would be 150 minutes moderate intensity of activity and 75 minutes vigorous intensive activity. And thank you. That was all from me. My apologies for taking a bit too long, but I'm open for questions. So any questions, I'm happy to answer.
Yeah, thank you very much for that session, ma'am.
No
It's
worries.
really good, one of the best we had recently.
I'm glad to hear that.
Thank you. So anyone has a question?
Hi.
Hi.
Hi, Derry. My apologies for not being there at the start. But as you can probably hear the noise, I'm just about to attend a football match.
Oh my God, that sounds exciting. That's a good thing to say if you're not coming to the session.
No, I'm not playing. I'm watching. And I take into consideration what you say about doing some movement. As I got older, I'm eating less. And I'm down now to 2 meals a day. Because I'm having dinner here at Old Trafford, I didn't have lunch. I had breakfast, but not lunch. What is the best time to finish eating at night? Because I normally count my 12 hours intermittent fasting from the time I finish to the time I start again. So question number 1, what's the best time to finish eating? Question number 2, how long should we have our intermittent fasting for? And the last question is, I'm an addict on TikTok. So every time a new product comes out, like the latest one is berberine. I don't even know what berberine is, but apparently if we have a squeeze of berberine, it'll bring down our sugar levels. How seriously should we take these products that are being offered on TikTok?
All right, I'm going to start from the back to the start of your questions. So in terms of supplementation such as berberine, the thing with supplementation, although it is not medication, so berberine is a supplementation, as some of you might know. The thing with the supplementation is we still don't have a strong regulatory system standing behind those supplementation. So if you decide, or if you're a patient, like let's say if you're a type 2 diabetic patient who is wondering about berberine, I would say, please, first things first, go to see your practitioner and take advice from them, not from social media. Because as I said, maybe for medications, and yes, for medications, we have strong guidelines, we have like strong regulatory system behind those medications. But in terms of supplementation, unfortunately, they're not that clear. The borders between like the clear recommendations and the clear guidelines that we have for supplementation, they're not that clear. So I would say before taking anything, please see someone who is like professional, who can give you advice in this. And do not take advice from social media, because actually recently we had a session on misinformation on social media, and it seems that only between 2 and 4% of the nutritional information that is going through social media is accurate. And you can imagine this is a really, really low percent. So please do not trust sources that they're just online and they don't have anything behind to support themselves, like such as like evidence-based information. Going to the other question about the intermittent fasting, maybe some people would not like my answer here, but is really, really personalized. And in terms of type 2 diabetes, I would say be really careful with intermittent fasting, because in some cases and in some instances, it can affect negatively. And as I said, it might lead to the opposite of hyperglycemia, which is high sugar levels, to low sugar levels, which is hypoglycemia. And if you fast for too long, you might not feel good in your body, and you might feel symptoms sometimes of that hypoglycemia. When we should stop eating at night, so there are some myths there that you should stop eating at 5 o'clock or 6 o'clock. And yes, there are some studies that are showing that our metabolic rates, like in utilizing energy and those calories, they decrease with the day going further, like in the evening, let's say. But there is no such rule that we have to stop eating, like let's say at 5 o'clock or 6 o'clock. What I would give as a suggestion would be just make sure that you're not eating 2 to 3 hours before bed, because it will also give you restless sleep, and it will that food may be disturbing you as well. You might not be able to utilize this food, like to digest it properly as well. So my advice would be just not eat, approximately 2 to 3 hours before bed.
Thank you very much. I'm going to hand you back to Rajiv in Leicester, because the noise here is getting very, very noisy.
I cannot hear it, don't worry. Thank you.
That's good. I think there are other questions in the chat that people want to ask you, and other people have their hands up. Thank you so much for doing this.
Thank you.
Over to you, Rajiv.
Yeah. Hi, Ms. Hussain. Mr. Amitabh Sharma has a question. He's put it in the chat. Long-term use of metformin in type 2 people can lead to kidney deterioration. Is there any dietary precaution or adjustment to be made to reduce these effects, or is this possible a renal specialist question?
Yeah, so probably I would try to answer to this question in my expertise, which might not be full answer to the question. But the main thing with metformin and the use of metformin in patients would be the fact that, again, when GPs or diabetes professionals prescribe metformin to patients, they don't have the time to explain to them about diet and how they should take this metformin. And I'm going to ask a question here, and I would expect just any answer. So what you would expect if I come to you, let's say I'm the GP, and I say to you, you're a type 2 diabetes patient, and I say to you, here's your metformin, you take it 2 times a day or 3 times a day, 500 milligrams or whatever. And also, I would strongly suggest you to stop eating carbohydrates. What you would expect to happen? Just give it a thought. There is no right or wrong answer. Any suggestions? What's going to happen with that patient if he stops eating carbohydrates and starts taking metformin as well?
You get a sickly feeling, you feel dizzy.
Yes, exactly. We were talking about this. It's all about the hypoglycemia. If we extract and avoid all carbohydrates, we don't have anything to actually increase our blood sugar levels. And if we, on the other hand, suppress blood sugar levels further, we will feel even worse, and we will have this state of hypoglycemia. So I would say the easiest thing that you can say to a patient when he or she is on a metformin is basically trying to control the metformin according to his dietary intake and carbohydrate intake to avoid this. But in terms of long-term effects on kidney function, probably, again, this is very personalized. It depends whether the patient had some risk before starting the metformin as well. Maybe this was a patient with high risk of kidney, failure. And we know that with type 2 diabetes and diabetes overall, it can be a risk of kidney failure with those patients. So again, it's really personalized. I would say that I'm scared to give any generalized, generic answer here. Apologies for that.
Okay, thank you, Ms. Hussain. Is there anyone with any other doubts? Any questions?
What's the best Indian food for a protein diet?
Oh, see, I'm probably not best placed person here because I'm so Turkish. I'm so Turkish. And I have no idea, but you can tell me, honestly.
Okay.
Like
There's more
lentils,
questions, I guess.
lentils, things like that.
Yeah, so lentils are high protein food. And I would just say that essentially it's not the thing that we have to avoid all carbohydrates. It's just matching and combining those carbohydrates. So let's say you're a type 2 diabetic person and you want to enjoy your rice, okay? Enjoy your rice, but make sure to add a source of fiber and a source of protein, because that will help that almost like that will lower the glycemic index, the overall meal, making the digestion of this glucose slower. So it will slowly increase your blood sugar and not rapidly increase it. So it's just about combining foods.
Very much. Thank you.
Thank you. Thank you. That was a great question.
Okay, I've got a question, please.
Yeah.
Well, 2 questions, if I may.
Yes.
Okay. The first question is, I get questioned by people who do not have diabetes that what's the difference between type 1 diabetes and type 2? Now, I know the difference, but I tend to chatter a lot. So what's the simplest way?
Yeah. So what's the simplest way?
Yeah, to differentiate and just, give them a snapshot of what the difference is.
So I think, first of all, I think what you're trying to do is really important, and what you're doing is really important, because a lot of specialists, they skip that part with explaining what exactly the patient has. And I think it's really important. So what I usually do in my practice, I try 2 different ways of explaining. One is longer, one is shorter. One of them would be that in type 1 diabetes, your pancreas basically is insufficient in making that insulin, and that's why they need to inject that insulin, over an injection, and take that insulin that way. Whilst type 2 diabetes is a completely different case, and type 2 diabetes, in my opinion, can be staged in different stages. So type 2 diabetes can be various with various people. So in one individual, it can be that the cells are actually resistant. So maybe the pancreas is producing enough insulin, but the cell is resistant. And maybe that we are on the other stage of type 2 diabetes where the pancreas actually started producing more and more and more insulin, where we actually start seeing abnormalities in the insulin production as well. So it can be staged in different various ways, but the easiest way to explain to patient, and I believe the important thing for them, is that type 2 is in most cases and in most stages, type 2 diabetes is reversible. Whilst with type 1 diabetes, we have to know, and we have to almost like learn to live with it.
Okay, that's a good answer. Best way to give it. Okay, so that second question is that I am of the Islamic background, like yourself. So what it is, we fast during the month of Ramadan, right?
Oh,
so
right,
I can
fasting.
handle that. Yeah, I can handle that any time of the year, even if it's summer, I can handle it. So what tends to happen is now winter is kicking in, right? I can fast because the days are shorter.
Yes.
Right? So I can do the ritual fasting. It could be classed as intermittent, but what then I tend to find is that my input is greater than not fasting and eating throughout the day. Right?
Do you mean that you eat more?
Aware of hyperglycemia. I do get really moody. I can feel lethargic, right? Sometimes it is just a mindset that I haven't eaten. I'm not having anything to drink, right? So I feel demotivated in doing other tasks, other things, just staying indoors. So all these things are effects of fasting, right?
Yeah.
But then I find that if I do fast, then long term, right, it may potentially help me. But then once I open the fast or break the fast, then
you overeat.
I feel, really full up.
You overeat. Yes.
Yeah, that's it. And then I get worried that, now I've had almost like in a short space of time, I've had 3 cups of tea or a hot chocolate and a coffee or something, right? Whereas if I would have had it throughout the day, then I could have had 2 cups of drinks, but they would be equally spaced out.
I get what you mean.
So this in Ramadan, I had never thought of it that way, right? But now in intermittent fasting or fasting outside the month of Ramadan, right? I feel that am I defeating the object, or am I really doing anything good or bad? Because what happens if I check my weight, then it will be low. If I'm fully watered and fed, then I'm looking at a lever of about 1.5 kilos, and that's how I have always been. See, so now I don't know how to decide whether fasting
or not.
Yeah, is important, or it's helping me, or should I fast, or what shall I do?
Okay, so I'm going to try to give a structured answer to this question as much as I can. And so this is the fact that you overeat after a big fast is because probably it's really simple, by the way. If you don't feed yourself, the natural state of the body is that you're hungry, right?
Yes.
Because your blood sugar levels drop, and your brain is really smart. There is something unconscious that we cannot control, and that unconscious is strongly linked to our full body. It's in there. And when your brain realizes that there is not enough blood glucose circulating in your circulation in your blood vessels, it can indicate to your brain that there is a lack of energy. And your brain, automatically, what it makes you want is it says, oh my God, I have to have something that will give me energy as fast as possible. And can you tell me in which foods we can find that fast energy?
Red Bull.
No, definitely not this one.
No?
But no. So
That's
fast.
a
The,
stimulation drink with the taurine in it.
I would not suggest anyone to drink those things, honestly.
Yes, a good
Yes.
job. I'm not addicted
Yeah.
to it, but
Yeah. It's it
once
has
in a
it's a
while,
whole
it
other
makes me feel better.
topic. But in
Okay.
terms of when you experience hypoglycemia and we've been fasting for so long,
Yeah.
in most cases, most individuals experience this feeling of the need of fast carbohydrates. So such as
Yeah.
like chocolate, sugars, maybe
Yes.
bread, pasta.
Yeah. What
So
I
you
would
feel
do, I
like,
would have a banana.
yeah, exactly.
This
So
is
this is
exactly
why you
something.
feel like it. And my personal advice, I would try not to give any, but I'm trying to answer the question.
Yes.
Would be if intermittent fasting is more negatively affecting you most of the time,
Yeah.
and you see that it is more negatively affecting you and you lose control over your dietary intake, I would say not to do intermittent fasting when it's not required.
Okay, when it's not required. Okay, I
Yes.
know what you mean. So, in other words, in summer, I will not intermittent fast because it's a long day and I don't want to fixate a time, right? Because it's not an Islamic fast. I don't want to fixate a time purely because I'll feel thirsty or I want to go out. I want to be able to do things, household chores, all that. So I need the energy for that, right?
Yes,
But
yes,
come
exactly.
winter, it's a shorter day, right? Even if I fast by intention Islamically, then you know the definition is from sunrise to
Sunrise to
sunset,
sunset, yes.
right?
Yes.
And it's a short day, right? Maghrib
Yes.
happens quite quick. So I would keep that intention, right? I
Yes.
would make that intention and I would keep the fast. But now I
Yes.
can see where you're coming from, that I shouldn't do it unnecessarily, even though
Exactly. If
it
it's
is
not working for you,
easy.
there is no, yes, if
Yeah,
it's not working for you, there is no need
yeah,
to torture yourself. There are many other ways in which you can control your type 2 diabetes and still reach
yeah,
remission without
yeah,
fasting.
yeah. Now it makes
Yes.
sense. Okay, now I've
No
got it.
worries.
It's more clearer.
Perfect.
Okay, thank you for that.
No worries.
Okay,
Hey
choose.
guys, I think we need to cut short the Q&A session. Now
Yes.
we can move to the news headlines by Dr. Steffi B. Rodriguez. Dr. Steffi?
Hello, everybody. Today's news headlines. The first news. Under 40s diagnosed with type 2 diabetes are 4 times more likely to die than the rest of the general UK population.
Wow.
Researchers from the University of Oxford examined data on 4,550 newly diagnosed diabetics aged 25 to 65 over a period of up to 30 years. Analysis revealed that adults with later onset type 2 diabetes have 1.5 times higher risk of death compared with the general population. The second news, 2 fruits that can cause type 2 diabetes, blood sugar levels to soar too high. Fruits are naturally quite high in sugars, and fruits will typically have more carbohydrates than non-starchy vegetables. Bananas and oranges are examples of more sugary fruits, whereas berries are examples of less sugary fruits. Given the high sugar content in banana and oranges, the Health Organization advises to bear this in mind to prevent blood sugar levels rising too high. The third news, eating one vegetable can reduce blood sugar up to 50% for people with diabetes. Researchers revealed that extract from onion pumps, Allium cepa, significantly reduced high blood sugar in diabetic rats when administered alongside with anti-diabetic drug metformin. Onion is cheap and readily available and has been utilized as a nutritional supplement, stated lead investigators. It holds potential for use in treating patients with diabetes. That's all for today's news, and happy Diwali to everybody. And good evening.
Yeah, that brings us to the end of Chai Chat. Thank you, Dr. Steffi. Thank you, Dr. Hussain. Thank you very much for the session. It was really helpful and informative. So anyone want to rewatch the session, it will be available in YouTube. And just go to Silver Star Diabetes YouTube channel. So thank you everyone for joining. Happy Diwali to all.
Thank you. Happy holidays and celebrations.
Thank you, ma'am.
Bye-bye.
Bye.